Bioequivalence study designs. Bioequivalence is required to be demonstrated to have equivalency in the therapeutic outcome for the generic formulations. All the generic formulations are required to show the bioequivalence. Bioequivalence testing is done in the human volunteers, that may be patients or healthy volunteers, and different designs are used for bioequivalence studies. So selection of the bioequivalence design or BE design is depend on the pharmacokinetics of the drug, variability of the drug, dosage form, and regulatory requirement. The product specific guidance are available from the regulatory authorities like US FDA, EMA, and some other. And based on these, the bioequivalence studies are designed. This video will give you the information regarding different designs. First is standard two-way crossover design, and in this design, the two groups are made for the patients to receive the test product and the reference product. The design is single dose, randomized, two period, two sequence crossover study, and two groups are made. One group receives the reference and another group receives the test, and it is crossover. Then the first group receives the test and the second group receives reference formulation. It is used for many of the immediate release formulations that may be tablet, capsule, or oral suspensions. The advantage of standard two-way crossover design is it is a simple design. It requires few subjects and widely accepted by the regulatory authorities. It has some limitations like it is not suitable for drugs with long half-life or the drugs which have a highly variable. Replicate crossover design, as the name indicates, it is replicate. It may be full replicate or partial replicate. Partial replicate is involving the three-way crossover, and the full replicate is four-way crossover. The design is subject receive the test and reference formulation multiple times. It may be three period or four period or three-way or four-way. It is used for highly variable drugs with the intra-subject variability of equal to or more than 30%. The advantage of this design is it allows use of scaled average bioequivalence to widen the BE acceptance limit. BE acceptance limit generally it is 80 to 125% CI, and if replicate study are used, then some widening in the Cmax level can be given. Limitation of the replicate crossover design, it requires more subject and complex statistical analysis. Then another is the parallel study design. The subjects are randomized to receive either the test or reference formulation, and it is a single period study. It is used for the long half-life drugs, where the washout period may extend the time for study. Drugs with long half-life, that means drugs with having half-life of more than 24 hours, where the crossover design is not possible because of long washout period. That time parallel study is used. This study is also used for some of the cytotoxic molecules, biologics, where repeat exposure should be minimized for the patients. Advantage of the parallel study design is it doesn't need long washout period and it is suitable for the long half-life drugs. The limitations are also there for parallel design. The limitation is that it requires larger sample size due to inter-subject variability. Steady state B design. This is another type of design, and in this multiple dose study is conducted until the steady state is achieved before the sampling. And steady state design is used for non-linear pharmacokinetics due to time dependent metabolism, and also for sustained release and extended release formulations where accumulation is the concern. Also, generally steady state design is used in the patients, like some cytotoxic molecules are there. For those, the steady state design is used on the patients who are already receiving the medication. Then partial replicate design. This is a three-way period, three-way design or three-period design. It is a replicate design as I have mentioned. Then three-period study where the reference drug is given twice, that is two times reference product will be given to the patient and only one time the test will be given. It is used for highly variable drugs when full replicate design is not feasible. It is also used for narrow therapeutic index drugs (NTIs) where additional PK assessment is needed. Some other designs are also used, like adaptive designs are being used with the clear written protocol. Also, alternative approaches are there for some complex formulations like inhalations, products, topical products, biosimilar products, and some biologic products. Inhalation and topical products require in vitro studies, PKPD correlation, or clinical endpoint studies instead of the standard BE designs. Biosimilar and biologics, these require totality of evidence approaches, immunogenicity assessment, and PKPD analysis. Adaptive designs are also used for some of the formulations where you can write down clearly the proposed changes in the bioequivalence study designs. I have made many videos on the bioequivalence study, so I request you to go through those videos to have a good idea about the bioequivalence studies. Thank you for watching the video and let's meet soon with such kind of informative